The clavicle, what are the important points you see first? First, you are supposed to know about the peculiarities of the clavicle. Okay, that is the very important point. What are the peculiarities? It is the only long bone that lies horizontally, that is one. It has no marrow cavity or medullary cavity, and it is the subcutaneous bone throughout its extent. Okay, these are the three. Next, it is the first bone to turn ossification, and it is the last bone to end ossification. Okay, that is the another important point. And it is the only long bone that identified by two ossification centers. Okay, all remaining long bones, they are having one primary ossification center and two more than two sometimes secondary ossification centers. But here, this is the only bone, it is having two primary ossification centers. That means the ossification centers, they appear before birth. Okay, that is the another important point. Next, it is the only long bone that ossifies in the membrane except for medial end. Okay, here usually long bones, they are ossified in the cartilage. But here this also ossifies in the membrane, most part of the bone, and most medial part by the cartilage. That is why this is the special bone. Sometimes they may ask in the MCQs like which bone, for the following bones, which bone is cartilaginous membranous or membrano-cartilaginous ossification. That means that is this bone, that is the clavicle. Okay, and sometimes it may be pierced by the supraclavicular nerve, especially middle branch of the supraclavicular nerve. Okay, these are the peculiarities. Next, in the clavicle, there is another important point. There is these attachments. That is especially the lateral 1/3 of the clavicle. That is providing, especially inferior surface, it is providing attachment to the one ligament that is called coracoclavicular ligament. Coracoclavicular ligament. That is a very important ligament because that is the ligament. It transmits the total weight of the upper limb to the axial skeleton. Axial skeleton. Okay, that is why this is the very important ligament, right? Coracoclavicular ligament. And this ligament again, it is having two parts. That is the conoid part and trapezoid part. Okay, that is why. Are you able to hear? Please message. Okay, next clinical aspects. That is a clavicle fracture is the most common, and the most common site for the fracture of the clavicle is at the junction of that is a medial 2/3 and lateral 1/3. Okay, that is the most common site for the fracture of the clavicle, right? And next, these are the some important points related to the clavicle. They may ask in the exam in different ways. So that is the MCQs or some other form, right? Next to scapula. In the scapula, there is a most important point here is suprascapular notch. Examination point of view. Okay, suprascapular notch. Which part it is which ligament is attached to the suprascapular notch? That is the transverse ligament, and the structures passing above and below. Above the ligament, that is the okay, right. Thank you. Okay, above the ligament, that is the above the ligament, that is the suprascapular vessels passes, and below the ligament, that is the suprascapular nerve passes. Okay, that is the another important point supposed to study. Next, after that, humerus bone. Humerus bone, that is intertrochanteric that is tubercular sulcus or bicipital groove. Okay, that is the another important point. What are the attachments here? Next, seat muscles attachments. Next, importance of the surgical neck of the humerus. Surgical neck of the humerus is clinically it is very important because it is the area, it is having very close relation with the axillary nerve. Axillary nerve, if there is a fracture of the surgical neck of the humerus, it leads to damage to the axillary nerve. Then the axillary nerve supplies to the which muscles? That is this is supplying to the that is a. Shall we go for another one? Okay, it is a surgical neck of the humerus, axillary nerve. It may cause damage to the axillary nerve. It is supplying to the deltoid muscle and that is a teres minor muscle and cutaneous innervation over the lower part of the deltoid region, then it is a effects. Suppose if there is a fracture, this one, it leads to damage to the this nerve. Okay, already I made videos about this surgical neck, all these points, humerus, all these things. Next, the radius bone, that is also important clinically, because the most common fractures of the radius is the lower part, especially in the lower, above the lower end. It produces a special deformity that is called Denner fork deformity. Denner fork deformity, that is the speciality of the special fracture of the this radius. And next, another fracture is Colles fracture. Colles fracture is also most commonly asked question. You also study about this Colles fracture and Denner fork deformity. Okay, these 2 points you are supposed to study. Okay, and next, in ulna related, there is no much important points, and especially related to ulna. Sometimes there may be fracture of both bones. Okay, both bones may be fractured. There is radius and ulna, and during that occasion there may be chances for cross union of these bones. So then it may lead to there is a difficulty in pronation and supination. Okay, that is another important point. Next, pronation and supination movements are also very important. Okay, what are the muscles which are producing pronation and what are the muscles producing supination? All these things you have to study. And in the pectoral region, the most important point here is there is a clavipectoral fascia. Clavipectoral fascia, it is a very important question in our exam. What are the structures piercing the clavipectoral fascia? That also you have to study. And extent of the clavipectoral fascia. Okay, all these things you have to study. Okay, clavipectoral fascia. That is another important point. Next, that is the serratus anterior muscle. Serratus anterior muscle is also very important because it is the muscle, it is supplied by the nerve of Bell or long thoracic nerve. That is if there is a fracture, the paralysis of this nerve, it produces winging of scapula. Winging of scapula, this is also most commonly asked question in your exam. Okay, that also you have to study. Winging of scapula and clavipectoral fascia. These are the 2 most important structures you are supposed to study. Next, coming to the breast or mammary gland in female mammary gland. Here, this is the very important essay question most of the occasions. Sometimes they may ask only blood supply to the mammary gland or for the short answer, or sometimes they may ask lymphatic drainage of the mammary gland, like that they may ask. But overall, this is the clinical scenario based question. Okay, that is why you must be very careful with the mammary gland. Definitely you will get one question from the mammary gland. It may be the essay question or it may be the short answer. Okay, there is short answers, there is blood supply to the mammary gland, and the lymphatic drainage of the mammary gland is also very important. Next, if they ask for the essay question, they may ask like this. There is a one female, elderly female, she is having some lump in the breast, like that. There is a skin changes in the breast, and there is a orange like skin, orange peel like skin appearance, carcinoma of the breast. All these things you have to study. Okay, that is extent of the breast, that is and location of the breast, and memory bed structures. Memory bed, what are the structures forming the memory bed? That is also very important, especially 3 muscles. That is the pectoralis major muscle, serratus anterior muscle, and external obliquus abdominis muscle. These are all the 3 muscles they are forming the memory bed. Even why it is memory bed is very important clinically means, suppose if there is a carcinoma of the breast, while removing the memory gland, that is a mastectomy. Removal of the memory gland is called mastectomy. It may be partial mastectomy or complete mastectomy or subtotal mastectomy. During that occasion, you are supposed to preserve the underlying muscles and its nerve supply and blood supply to prevent complications. Okay, that is why memory blood structures are also very important. Okay, that is another important point. Okay, applied aspect related to this memory gland. This is very important in our exam. Okay. Next, lymphatic drainage. Lymphatic drainage, you have to practice the diagram. That is very important. Lymphatic drainage of diagram. That is you must practice. Sometimes you may get for the short answers. This mammary gland lymphatic drainage. Okay. Next, after mammary gland, you go for axilla. In the axilla, that is the most important structure. Is the question in the exam most commonly asked is the number 1 is the brachial plexus, number 2 is the axillary artery, and boundaries and contents of the axilla and its clinical aspects. Okay. First, you see axilla. What is axilla? What are the boundaries? Anteriorly, what are the muscles forming the boundary, and posteriorly, medially, and laterally. And next, this is the very important structure in the axilla is the axillary artery. Axillary artery, already you know, it is nothing but the continuation of the subclavian artery after crossing the first outer border of the first rib. We call it as axillary artery. Then where it ends at the lower border of the teres major muscle, where it ends. Between these two, outer border of the first rib and lower border of the first teres major muscle, that is a artery that is called axillary artery. This axillary artery is divided into 3 parts with the help of the pectoralis minor muscle. Sometimes they may ask which muscle divides the axillary artery into parts, 3 parts. There is the above the pectoralis minor muscle, that is called first part, and deep to the pectoralis minor muscle, that is called second part, and below the pectoralis minor muscle, that is called third part. And branches. Branches, there is one branch from the first part, that is the superior thoracic artery, and 2 branches from the second part, that is the acromiothoracic artery and lateral thoracic artery, and 3 branches from the third part, that is the subscapular artery. That is the largest branch of the, this is also very important MCQ in your exam. That is the subscapular artery is the largest branch of the subclavian artery, that is the axillary artery, and 2 circumflex femoral, that is the anterior circumflex femoral and posterior circumflex femoral arteries. These are the arteries, right? That is the axillary artery. Apart from the axillary artery, we also need to study about the circumflex. There is anastomosis around the scapula. Anastomosis around the scapula. This is also most commonly asked question in it may be a short answer, or it may be the that is the MCQs also. That is what are the blood vessels which are taking part in the formation of this scapular anastomosis. That is a deep branch of the transverse cervical artery, and superior scapular artery, and suprascapular artery. Suprascapular artery and circumflex scapular artery. Okay, these are all the, this is the branch from the scapular artery. All these branches together, they form the anastomosis around the scapula. Okay, this anastomosis around the scapula, it supplies the muscles which are attached to the this scapula. Okay, that is also very important question in your exam, right? And this is also playing most important role in collateral circulation, because if you see the suprascapular artery and transverse cervical artery, they are the branches from the subclavian artery. And next, these remaining branches, there is a circumflex scapular artery and anterior and posterior circumflex femoral arteries. These are all the branches from the axillary arteries. Suppose if there is any obstruction or narrowing or any blockage of this axillary artery, through the blood will bypass through this collateral circulation will be maintained to the upper limb. Okay, then the limb is saved. Otherwise, you may lose the limb. Okay, that is why this is also anastomosis around the scapula. That is also very important in an examination point of view. Next, coming to the another important structure related to the this axilla, that is the brachial plexus. Brachial plexus, this is also very important structure. Okay. Next, brachial plexus, what are the structures which are taking part in the brachial formation of brachial plexus? That is the first one is the C5, C6, C7, C8 and T1. That is the anterior rami of these nerves. There is the cervical, spinal nerves and T1 nerve. It is taking part in the formation of brachial plexus. And this brachial plexus, there are 3 important parts. That is the first roots, next trunks, divisions, cords. RTDC. Roots, trunks, divisions, cords. RTDC. And there are branches from the roots, there are branches from the trunks, but there is no branch from the divisions. Okay, this is also most commonly asked question in your exam. Which part of the brachial plexus is not giving branches? Okay, that is the divisions. From the divisions of the brachial plexus, there are no branches. but there are branches from the roots, there are branches from the trunks, there are branches from the cords, right? And next, from the roots, one important nerve, that is the long thoracic nerve. Already I told you, this is the nerve of the nerve supply to the serratus anterior muscle. Okay, this serratus anterior muscle, it is very important muscle. If this nerve gets damaged, it produces a condition that is called winging of scapula. Okay, that is the important point. Next, another important nerve is the dorsal scapular nerve. Dorsal scapular nerve, it goes and supplies to the muscle. And next, trunks, branches from the trunks are also very important clinically, especially the upper trunk. There is one special zone in the upper trunk that is called Ebb's point. Ebb's point. If there is any injury or any damage to this Ebb's point, it leads to Ebb's paralysis. Ebb's paralysis, that is another important clinical question in your exam. Okay, Ebb's paralysis. Suppose if there is a damage to the lower trunk, it leads to another clinical condition that is called Klumpke's paralysis or Klumpke's palsy. Klumpke's paralysis or Klumpke's palsy. These are all the two most important clinical aspects which are related to the brachial plexus. Next, afterwards, there is divisions. Again, divisions together they form the cords. Cords are medial cord, lateral cord, and posterior cord. These cords are divided in relation with the axillary artery, especially second part of the axillary artery. In relation to the second part of the axillary artery, these cords are divided. That is the lateral cord, it is lateral to the second part of the axillary artery. Medial cord, medial to the second part of the axillary artery, and posterior cord is posterior to the second part of the axillary artery. And there are branches. Overall, there are 13 branches from the cords of the brachial plexus. So 13 branches. Out of these 13, from the lateral cord, there are 3 branches. Lateral cord, 3 branches. That is, first one is the lateral pectoral nerve. Next is the musculocutaneous nerve of the arm. And next, last one is the lateral root of the median nerve. So these are all the 3 branches from the lateral cord. Next, from the medial cord, there are 5 branches. That is, the first one is the most important nerve of the medial cord is the ulnar nerve. Next, another one is the medial pectoral nerve. Next, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, and medial root of the median nerve. So total 5 branches from the medial cord of the brachial plexus. Next, from the posterior cord also there are 5 branches. That is, posterior cord, 2 most important nerves are there. First one is the radial nerve. Next is the axillary nerve. These are the 2 most important nerves. They are the branches from the posterior cord. Then apart from this, there are 3 upper subscapular, lower subscapular, and middle subscapular, thoracodorsal nerve. These are all the 3 branches from the posterior cord only. So total how many? 5 branches from the posterior cord, 5 branches from the medial cord, and 3 branches from the lateral cord. Total 13 branches from the cords. Okay, these are all the things you're supposed to remember about the brachial plexus. Then you have to practice the diagram of the brachial plexus. Okay, that is also very important. Okay, next, coming to the here the power loss. Just I will take a few seconds. Okay, next, apart from this, along with this brachial plexus, you are supposed to study about the applied aspects related to the brachial plexus. That is, number 1 is the Klumpke's palsy, the lesions of the brachial plexus, and next, Erb's palsy. Erb's palsy, you know, that is the stretching of the shoulder while passing through the birth canal, or you fall like this. Okay, there is a wide gap between the neck and the shoulder, then it leads to damage or stretching of the upper trunk of the brachial plexus, then it leads to Erb's palsy. And Klumpke's palsy or Klumpke's paralysis, that is a lower trunk of the brachial plexus injury, it leads to Klumpke's paralysis. That is hanging from the height, while falling from the height, if you hold like this, you may hang. Or while passing through the birth canal, if they drag the baby by holding the hand, in that occasions they may develop this Klumpke's paralysis. Okay, these are the 2 most important structures you are supposed to know. Next, coming to the scapular region. Scapular region muscles, you know already. I think this is the next. Another important thing in the scapular region is that is you are supposed to know about the auscultation triangle. Auscultation triangle. What are the boundaries of the auscultation triangle? That is also you are supposed to study. Sometimes they may ask short answer, or they may ask as a MCQ also. Okay. Next, intramuscular spaces of the scapula. Okay. Or first you see about the or deltoid muscle. Deltoid muscle is also very important muscle, because this is clinically it is very important, because if you want to give intramuscular injections, there is a they may ask the clinical scenario question. There is a anatomy behind the intramuscular injections to the deltoid muscle. Like that they may ask. Okay, that is an important question where you are supposed to give intramuscular injections, and which nerve is probably damaged if it is not given in proper position. Okay, and if you give in miss position, it may cause damage to the axillary nerve. Axillary nerve gets damaged, then it leads to paralysis of the deltoid muscle. Then the individual is unable to abduct the shoulder above the 15 degrees. Above 15 degrees, if you want to abduct, you need a deltoid muscle. Okay, and it is also axillary nerve. Not only it is supplying to the deltoid muscle, it is also supplying to the teres minor muscle, then skin over the deltoid region, especially in the royal part of the deltoid region. So all these things you have to study. Nerve supply to the teres minor is the axillary nerve. Okay. Next, coming to the shoulder joint, the rotator cuff muscles. Rotator cuff muscles. What are the rotator cuff muscles? Definitely they ask as a MCQ or short answer. Okay, rotator cuff muscles they ask as a short answer. That is the supraspinatus, infraspinatus, teres minor, and subscapularis. Supraspinatus, infraspinatus, teres minor, and subscapularis. Okay, these are all the muscles. Okay, they are called rotator cuff muscles. They form a protective structure around the shoulder joint. Then they protect the shoulder joint from dislocation. Okay, that is the rotator cuff muscles also is supposed to study. Next, coming to the intramuscular spaces. Intramuscular spaces at this scapular region here. There is between the long head of the triceps muscle and teres minor muscle and teres major muscle. There are three spaces. That is the upper triangular space. Okay, like this. You can see like this. Okay, upper triangular space and quadrangular space and lower triangular space. Okay, this is the upper triangular space. This is the quadrangular space, and this is the lower triangular space. And what are the boundaries of these spaces, and what are the structures passing these spaces? That is a very important question in exam. Definitely they ask one question from this one. Whether they may ask as a short answer, or they may ask as a MCQ. Okay, what are the structures passing through the upper quadrangular space, or what is the structure passing through the upper triangular space? And most commonly asked is what are the structures passing through the lower triangular space? Because lower triangular space is very important, because this space, it is providing passage for the radial nerve and profunda brachii artery. Radial nerve and profunda brachii artery. These two structures they pass through this one. Then you have to see the axillary nerve passes through the upper quadrangular space. Okay, this is also important. And the axillary nerve itself is a very important question in your exam. Okay, you must practice the diagram of the axillary nerve. That is upper anterior branch, anterior division, posterior division, all these things you have to study. Next, the shoulder joint itself is a very important essay question in your exam. Okay, you must study all the points related to the shoulder joint, dislocations, all these things. Next, coming to the cubital fossa. Cubital fossa is also very important structure. That is the veins of the upper limb. Three veins are there. Okay, one is the cephalic vein, this is the basilic vein. In between there is a median cubital vein over the cubital fossa, and this is the most commonly used vein for the venipuncture or drawing blood or injections, all these things. Why? Because this vein, it is connecting the cephalic vein with basilic vein. Not only this, it also connected with the deep veins to the perforating vein. Okay, because of this perforating vein, it is passing through the bicipital aponeurosis. Then because of this, when you stretched or extended the elbow, it is fixed. This vein is fixed and it won't move, because other veins, if you try to insert a needle into the other veins, they may skid because they are just below the skin. Skin is loose. Okay, that is the another important point you are supposed to know. Next, median cubital vein and venous drainage of the upper limb also important. Next arm, in the arm we are supposed to study about the one important nerve, that is the muscular coordination of the arm. Muscular coordination of the arm, this is the most commonly asked question. It is a branch from the lateral cord of the brachial plexus. Why it is called muscular coordination arm is, it is first it applies to the muscles, right? That is the three muscles of the front of the arm. That is the brachialis, biceps brachii and the coracobrachialis. Then it pierces the tib fascia. Then it becomes a lateral cutaneous nerve of the forearm. Lateral cutaneous nerve of the forearm. That is why it is applying to the muscles, then skin. That is why it is called muscular cutaneous nerve. Okay, that is the supposed to study about this nerve. Muscular cutaneous nerve or the superficial. Okay, it is skin plus muscles. Next, brachial artery. Brachial artery, it is also very important. It is nothing but the continuation of the axillary artery. That is below the teres major muscle. Okay, especially lower border of the teres major muscle. Up to the lower border of the teres major muscle, we call it as axillary artery. Below that, that is called brachial artery. Brachial artery starts at the lower border of the teres major muscle. Okay, this is also very important MCQ question they may ask in the exam. And where it ends, that is also very important. Where it ends, that is the neck of the radius. Okay, from the neck of the radius, from the lower border of the teres major up to the neck of the radius, that is the extent of the brachial artery. At the neck of the radius, this brachial artery divides into two terminal branches, that is the radial artery and the ulnar artery. Okay, so that is the extent. Brachial artery, it extends from the lower border of the teres major muscle to the neck of the radius. Okay, right? That is the brachial, and then branches from the brachial artery. This is the superior ulnar collateral artery, inferior ulnar. The most important branch from the brachial artery is the profunda brachiae artery. Just like in lower limb we had seen profunda femoris artery. Just like that, here also in the arm there is a one branch, big branch from the brachial artery. That is the branch which supplies to the most of the muscles of the arm. That is why it is called profunda brachiae artery. And there are collateral branches. From the profunda brachiae artery, there are anterior descending branch, posterior descending branch. All these branches, along with the recurrent branches from the ulnar artery and radial artery, all together they form the anastomosis around the elbow joint. Okay, this is also another important anastomosis apart from the scapular anastomosis. Anastomosis around the elbow joint is also important. Right? Next, brachial artery. Profunda brachiae artery. Next to branches from the, there is a brachial plexus. That is the median nerve. Next, ulnar nerve. Okay, these are all diagrams. Along with the diagrams you are supposed to study. And related to the ulnar nerve, you know, that is a Saturday night pulse. There is a compression of the radial nerve at the spiral groove or radial groove. Okay, that leads to a temporary paralysis of the extensor of the muscles of the forearm. That is called, there is a Saturday night palsy. Okay, that is also you supposed to study. Next, what is there? Forearm. Forearm, there is no much important structure exam question. Only thing is there is a cubital fossa in front of the elbow joint and cubital fossa. These two are the important. Cubital fossa, boundaries, contents, these things you have to study. Cubital fossa. What are the boundaries of the cubital fossa? What are the contents of the cubital fossa? And within the roof of the cubital fossa, there is a median cubital vein. What is the importance of the median cubital vein? All these things they have to study. Right? And next, flexor retinaculum. Flexor retinaculum is also very important question. What are the attachments of the flexor retinaculum? And what are the structures passing deep to the flexor retinaculum? They may ask. And next, carpal tunnel syndrome. Carpal tunnel syndrome is also very important question. Carpal tunnel syndrome. Okay, what are the, especially compression over the median nerve, because the carpal tunnel is a very narrow space, because this is the flexor retinaculum and these are the carpal bones. Between these two, there is a narrow space. The median nerve passes through this. Whenever there is a small swelling or any inflammation or any edema, okay, or bony growth, that is ganglions, or growth from the tendons, that is called ganglion. All these structures, they may produce compression over the median nerve. Then it leads to visual manifestations. Okay, so that is the carpal tunnel syndrome. That is also important question in exam. Okay. Next, pronation and supination movements. Pronation and supination movements. What are the muscles producing the pronation and supination? Okay. Elbow joint is also important. Ligaments of the elbow joint. Sometimes they may ask. Carrying angle. Carrying angle is also very important. Carrying angle means that is the angle between the forearm and arm. Forearm and arm, the medial side of the arm. You will get there is a E like this, or you see here like this. This is the carrying angle. That is more in females. More in females, less in males. That is another important point. And these are all the points. Supination, pronation is also very important question in your exam. Coming to the hand is supposed to study about the flexor retinaculum, next carpal tunnel, next spaces. That is also very important question. Pulp spaces, mid palmar space, spaces of the hand and its clinical aspect. Okay, these are the most commonly asked questions. Next, there is another important thing. There is a vincula longa, vincula brevia అని ఉంటాయి. అవి చదవండి ఒకసారి. Vincula longa tendons, attachments of the tendons of the muscles. They are attached to the bones by connective tissue structures. They are called vincula longa, vincula brevia. These are the things. Next, superficial palmar arch. Superficial palmar arch, it is formed by, mostly it is formed by ulnar artery. It is completed by superficial branch of the radial artery. And deep palmar arch. Deep palmar arch, it is mostly formed by radial artery. It is completed by deep branch of the ulnar artery. Okay, these two arches also is supposed to study in the hand. And next, hand muscles, especially intrinsic muscles of the hand. That is thenar muscles, hypothenar muscles, and its nerve supply, and lumbricals. Lumbrical muscles is also very important to short terms. Okay, these things you have to study. And the muscles, what are the muscles which are supplied by the ulnar nerve? What are the muscles which are supplied by the median nerve? These two is a must know. Okay, so this is the another important point supposed to study in the hand. Okay, and the spaces, mid palmar space, pulp spaces. Okay, infections. If there is any infection or any there is a pus accumulation, it leads to swollen manifestation. Next, another one is this is the snuff box. Anatomical snuff box is also important. It's supposed to study boundaries of the anatomical snuff box and structures passing through the anatomical snuff box. Okay, that is also important. And next, here there is one space that is called space of Parona. Space of Parona. There is a in front of the quadratus femoris, what do you call quadratus muscle. Okay, quadratus muscle, and within the bit deep to the tendons of this flexor muscles, there is a space that is called space of Parona. This mid palmar space infection through the space of Parona, it may extend to the lower part of the forearm also. Okay, that is called space of Parona. Okay, these are all the points. Next, there is a innervation, cutaneous innervation of the palm. That is a palmar aspect. It is supplied by two nerves. That is the median nerve, ulnar nerve. Okay, medial 1.5 finger by the ulnar nerve, lateral 3.5 finger by the median nerve. Suppose if you come to the dorsal aspect, medial 1.5 finger by the ulnar nerve same, but the lateral 2.5 fingers, lateral 3.5 fingers, it is by the radial nerve. Okay, that is the difference between the palmar aspect and dorsal aspect. In palmar aspect, the lateral 3.5 fingers by the median nerve, but in the dorsal aspect, it is by the radial nerve. Okay, that is the important point you are supposed to remember. Sometimes they may ask as a short answer, right? And next, coming to the carpal bones, they may ask as a there is a short answers, or sometimes they may ask as a MCQs. Carpal bones, out of the how many carpal bones are there? 8 carpal bones. They are arranged in 2 rows, proximal row and distal row. Okay, proximal row, what are the bones? From lateral to medial. Okay, from lateral to medial, that is a scaphoid, lunate, triquetral and pisiform. That is the proximal row. Next distal row, there is a trapezium, trapezoid, capitate, hamate. And out of all these 8 carpal bones, okay, out of all these 8 carpal bones, out of all these carpal bones, that is, some carpal bones are clinically very important. First, you take about the fusiform bone. Fusiform bone, this is the very important bone because it is a sesamoid. It is not the bone. This bone, it develops in the tendon of the flexor carpi ulnaris tendon. Flexor carpi ulnaris tendon. Okay, it gets inserted to this fusiform bone. That is the importance. Next, another important thing, that is the scaphoid. Scaphoid bone is the first bone of the lateral proximal row. Okay, first bone. Then here the scaphoid, it is having a waist. It is a posterior part, anterior part. In between these 2 points, there is a narrow area that is called waist of the scaphoid. Then the this is when you fall on the hand like this. If you fall like this, there is chances for this fracture of the scaphoid, waist of the scaphoid. Then it leads to avascular necrosis of the proximal part of the scaphoid, because the blood vessels which are entering into the scaphoid bone, they are passing through the distal part. Okay, suppose if there is a fracture of this waist, the proximal part is lacking blood supply. That is why it leads to avascular necrosis. That is another point related to the scaphoid carpal bones. That is, the first one is the fusiform, next is the scaphoid. Next, another thing, lunate bone. Lunate bone is also clinically very important because all carpal bones, they are arranged in the like this fashion. Okay, this dorsal part, it is wider, palmar aspect is narrower. Okay, like this. Okay, upper part, this is the wider, lower part is narrower like this. So that is why they won't dislocate anteriorly. But the lunate bone is peculiar because it is palmar aspect is wider and dorsal aspect is narrower. Okay, because of this reason, there is a chances for damage. There is a dislocation of the anterior dislocation of the lunate bone. Then it may cause compression over the median nerve. Then it produces carpal tunnel syndrome. Okay, that is why that is also very important point. Okay, next carpal bone is the capitate. Capitate bone is also special because this is the bone, the largest carpal bones. They may ask which is the largest carpal bones. That is the capitate is the largest carpal bones. Okay, these are all the some points which are related to the carpal bones, right? And these are all the points I think I covered. Next, related to the upper limb, right? Next, nerves and nerve injuries. These are all the things you are supposed to study. Okay, all nerves without taking any choice. All nerves, especially the radial nerve and medial nerve, ulnar nerve. These are all very important now. That is related to the radial nerve. That is, first is the injury to the radial nerve at the axilla, or injury to the radial nerve at the radial groove. Okay, and compression over this nerve. This nerve, that is also most commonly asked, or sometimes at the elbow joint. At 3 levels you are supposed to study. Depending upon the level of the injury, what are the muscles involved, all these things you have to study. Next, median nerve, especially, that is the carpal tunnel syndrome, that is related to the median nerve. And ulnar nerve, medial condyle of the humerus fracture, it may lead to damage to the ulnar nerve. And axillary nerve, that is the surgical neck and its aspects, already we discussed, right? These are all the points you're supposed to study in the upper limb. Okay, the most important points you have to concentrate in the upper limb is, first is the shoulder joint, is very important. Next, deltoid muscle. Deltoid muscle, intramuscular injections to the deltoid, that is another important point. Next, clavipectoral fascia and axilla, contents of the axilla. Axillary brachial plexus, axillary artery, boundaries of the axilla, all these things you are supposed to study. Next, musculocutaneous nerve. Okay. Next, injuries to the brachial plexus. Next, elbow joint plus cubital fossa, median cubital vein, important. Next, radial nerve, ulnar nerve, median nerve, axillary nerve. Then, breast, mammary gland, lymphatic drainage, blood supply. Total mammary gland itself is a very important question. Next, hand, flexor retinaculum, తర్వాత కార్పల్ టన్నల్ సిండ్రోము, నెక్స్ట్ సూపర్ఫిషియల్ పామర్ ఆర్చి, డీప్ పామర్ ఆర్చి, తర్వాత పల్ప్ స్పేసెస్, తర్వాత మిడ్ పామర్ స్పేస్. Okay, these are all the important point. Next, intrinsic muscles of the hand, that is thenar muscles, hypothenar muscles, lumbricals, intraossei, palmar and dorsal intraossei, and its nerve supply, that is also very important. Okay, these are all the things you are supposed to study about the upper limb. Next, coming to the lower limb. The lower limb, already we discussed previously some points. లోయర్ లింబ్లో మనకి బోన్స్ ఫస్ట్ ఈస్ ద లీనియా యాస్పెరా. లీనియా యాస్పెరా ఈజ్ వెరీ ఇంపార్టెంట్ క్వశ్చన్ ఇన్ ఎగ్జామినేషన్ పాయింట్ ఆఫ్ వ్యూ. అండ్ నెక్ ఆఫ్ ద ఫీమర్ ఈజ్ ఆల్సో వెరీ ఇంపార్టెంట్. అండ్ ischial tuberosity, bones related ischial tuberosity, and what are the subdivisions of the ischial tuberosity, and what are the muscles attached to the ischial tuberosity. Okay, these are all the important things which are related to the bones. Next, adductor tubercle. What is adductor tubercle? It is above the medial condyle of the femur. There is a small bony prominence that is called adductor tubercle. Next, sesamoid bone. That is the patella. Patella is a special bone because it is a sesamoid bone. It is not having periosteum. There is no marrow cavity. Okay, and because it is developed in the tendon. Okay, that is the another important point. These are all the bones we are supposed to study. Next, coming to the tibia, that is especially the upper end of the tibia. That is what are the attachments? There is intracapsular attachments of the tibia. Okay, that is also within the knee joint. That is a medial meniscus, the cruciate ligament, anterior cruciate ligament. Next, lateral meniscus, and most posterior ramus of the lateral meniscus. Next, posterior ramus of the medial meniscus. Next, posterior cruciate ligament. So all these things is supposed to study intra-articular structures of the knee joint. Okay, that is also important. Next, coming to the fibula. In the fibula, especially, it is very important thing is in the fibula is neck of the fibula. Neck of the fibula is clinically it is very important because this is the area it is having very close relation with the common peroneal nerve. At this level only, common peroneal nerve divides into two nerves. There is superficial peroneal nerve and deep peroneal nerve. Okay, superficial peroneal nerve, it goes to the lateral compartment of the leg, that are peroneal compartment of the leg, and deep peroneal nerve, it goes into the anterior compartment of the leg and supplies to the muscles. Okay, so that is why the neck of the fibula is clinically it is very, very important. Next, the practical exam, how to determine the side of the fibula means there is a malleolar fossa. By keeping the tip of the thumb in the malleolar fossa, that way you can decide this one. Okay, next, talus bone is also most commonly asked question in an exam. Okay, study in detail about the talus. Okay, there is what are the surfaces, all these things, right? Next, in the front of the thigh lo manaki great saphenous vein and femoral triangle. It is very important, boundaries and contents of the femoral triangle. And great saphenous vein, most commonly asked essay question from the lower limb is the hip joint, knee joint, and venous drainage of the lower limb. Venous drainage, especially veins of the lower limb, because clinically they are very important. They may produce varicose veins. So that is why there is venous drainage of the lower limb is also most commonly asked essay question. Next, I don't want to go into detail about the anterior compartment. What are the muscles of the anterior compartment, medial compartment, and only thing is supposed to study about the special areas. That is the obturator nerve. Obturator nerve, it is very important because it is the nerve of the medial compartment. And referred pain means this obturator nerve actually it is formed in the lumbar region along with the posterior wall of the abdomen. Okay, that is a psoas major muscle, then lateral wall of the pelvis, then it enters into the thigh. Okay, here while passing through this in females especially, it is passing close to the floor of the ovarian fossa. Then if there is any ovarian pathology, it may cause irritation of this obturator nerve. Then it produces pain in the knee joint, hip joint, and medial side of the thigh. Okay, that is why it is also you're supposed to study. Obturator now. Obturator and femoral triangle, femoral hernia, boundaries, contents, everything is important. Femoral canal, all these things you're supposed to study. Next, adductor canal. Adductor, thylo, manaki adductor canal is also very important. What are the boundaries of the adductor canal and what are the other names of the adductor canal? That is, it is also called Hunter's canal, or it is also called subsartorial canal because it is below the sartorius muscle. All these things I think you know. Next, profunda femoris artery. Profunda femoris artery is also branch of the femoral artery in the thigh. Okay, and median venal point. Median venal point. What is the importance of the median venal point? That is what is median venal point? It is a point between the anterior superior iliac spine and the pubic symphysis. Pubic symphysis. That is the one important point. And midpoint of the inguinal ligament is different from the median venal point. Median venal point, it is exactly corresponds with the location of the femoral artery. Femoral artery. Okay. So obturator nerve, femoral triangle, and in the gluteal lesion, there is one important question from the gluteal lesion, that is the Trendelenburg sign. Trendelenburg sign, because the superior gluteal nerve, it is applying to the three important muscles in the gluteal region. That is tensor fascia lata, next gluteus medius, gluteus minimus. These three muscles, they are maintaining the balanced position of the pelvis. Okay, that is, if there is any damage while giving intramuscular injection to the gluteal region, where you are supposed to give intramuscular injection, that is the upper and outer quadrant of the gluteal region is the ideal site for the intramuscular injection. Suppose if you give in the wrong place, it may cause damage to the superior gluteal nerve. Then it leads to paralysis of these three muscles. Then it is produce Trendelenburg sign positive. Okay, that is the most commonly asked question in an exam. Okay, and next piriformis muscle, it is also supposed to study because this is the key muscle of the gluteal region. Key muscle of the gluteal region. The structures passing above the piriformis and below the piriformis, and gluteus maximus muscle. Gluteus maximus muscle also is supposed to study. And next gluteal region, that is the superior gluteal nerve. It is a very important. Next, back of the thigh. Back of the thigh lo manaki that is hamstring muscles. Hamstring muscles. What are the hamstring muscles? What is the criteria for a hamstring muscles? And hamstring. What are the hamstring muscles? That is biceps femoris, semitendinosus, semimembranosus, and a hamstring part of the adductor magnus. Again, they are classified into true hamstrings, false hamstrings. There is a criteria. What is the criteria for hamstring muscles? If you want to call them as a hamstring muscle, they must fulfill 4 points. First is they must take origin from the ischial tuberosity. That is number 1. They must be supplied by the tibial component of the sciatic nerve. Number 2. And they must insert to the one of the leg bones. That is number 3. And they must produce flexion at the hip, flexion at the knee. Okay, these are the 4 points. Whichever muscle which is fulfilling all these 4 points, they are called true hamstrings. The muscle which is not fulfilling, that is called false hamstring muscles. Okay, if you see in the back of the thigh, there is only 3 muscles they are following. That is the first one is the semitendinosus, semimembranosus, and long head of the biceps, not the short head of the biceps, because short head of the biceps is taking origin from the linea aspera, lateral lip of the linea aspera, and adductor magnus, the hamstring part of the adductor magnus, actually it is getting inserted to the adductor tubercle of the femur, not to the leg bones. Okay, that is why these two are not the true hamstring muscles. Okay, that is an important point you are supposed to know. Next, to sciatic nerve. Sciatic nerve itself is a very important clinical question. There is sometimes they may ask as an essay also. Okay, they may say that is one female, she is a 40 years or 50 years like that. She is complaining of pain in the back of the thigh and it is extending up to the foot, leg, all these things. While bending like that they may ask. Okay, so that is the sciatica is also very important question. Sciatic nerve. Next, coming to the popliteal fossa. Popliteal fossa is supposed to practice the diagrams related to the popliteal fossa, that is boundaries. Next, surface, that is a floor of the popliteal fossa. Next, contents. Okay, all these things you're supposed to study. And arterial anastomosis in the back of the thigh. That is also very important. That is a trochanteric anastomosis, cruciate anastomosis, and longitudinal anastomosis. These are the three anastomosis because in the back of the thigh there are no big vessels. Okay, these are branches from the profunda femoris artery only. They are going back. They are forming anastomosis and they are supplying to the structures of the back of the thigh. Okay, that is why this anastomosis is also very important. Next, anastomosis around the knee joint. Anastomosis around the knee joint. This is the anastomosis between the branches of the femoral artery, popliteal artery, and there is an anterior and posterior tibial artery branches. Okay, that is also supposed to study. Okay, you practice diagrams. Next, hip joint. It is very important and a stock question. And in the hip joint, sometimes they may ask short answers also. That is, what are the ligaments of the hip joint, and there is a fracture of the hip joint, the neck of the femur it leads to, and like that they may ask. Okay, and knee joint is also, and what are the blood vessels which are supplying to the neck of the femur? Sometimes they may ask. That is the retinacular vessels from the medial circumflex femoral artery, and retinacular vessels from the lateral circumflex femoral artery, and that is another branches from the nutrient artery. Okay, these are all the branches. There are some, and then there is another small branch from the, it passes through the, there is a neck of the fovea capitis. Fovea capitis, it is providing attachment to a ligament that is called ligamentum teres femoris. Ligamentum teres femoris. These vessels they are supplying to the neck of the femur. If there is a major supply is from the retinacular vessels from the anterior and posterior circumflex. Because of this reason, if there is any fracture of the neck of the femur, it leads to necrosis of the head of the femur. Okay, that is another important point. And next, in the leg, that is the superficial peroneal nerve and deep peroneal nerve. These two are the most important questions, especially musculocutaneous nerve of the leg. There is a superficial peroneal nerve. This is a lateral compartment of leg muscles supplied by this musculocutaneous nerve. Okay, or superficial peroneal nerve, and deep peroneal nerve it supplies the anterior compartment. These things you have to study. And next, there are retinacula. There are many retinacula in the lower limb. That is also flexor retinacula, extensor retinacula, peroneal retinacula. All these retinacula is supposed to study. Next, another important thing, dorsalis pedis artery. Dorsalis pedis artery is also most commonly asked question. Not only in the theory exam, it is also asked in the practical exam. Especially surface markings, all these things they may ask. Dorsalis pedis artery. Dorsalis pedis artery. Next, arches of the foot. Arches of the foot is also very important and stock question. Okay, and MCQs sometimes they may ask dorsum of the foot innervation. Dorsum of the foot innervation by the four nerves. That is the most medial part by the saphenous nerve, most lateral part by the sural nerve, and most part of the dorsum of the foot by the superficial peroneal nerve, and the web between the great toe and second toe, that area is supplied by the deep peroneal nerve. Okay, then sometimes they may ask there is a web between the great toe and second toe, that area is supplied by which nerve? Cutaneous innervation by which nerve? Like that they may ask. Okay, and next, arches of the foot. Arches of the foot is also very important question, stock question. Sometimes they may ask as a short answer, especially medial longitudinal arch is a short answer, and arch of transverse arch, medial longitudinal arch, lateral longitudinal arch, all these arches they may ask as a essay question. Next, deformities of the foot. Foot deformities also most commonly asked in your exam. There is a different conditions of the foot. Okay, there is a next there is a dorsal long great saphenous vein already we discussed. That is a very important question. Next, coming to the posterior compartment, that is a posterior compartment muscles. There is a superficial muscles. There is a first is the gastrocnemius, then soleus, then deep to that there is a plantar, small muscle plantaris. Then further deep to that there is a popliteus. Then there is another two muscles. There is a flexor digitorum longus, flexor hallucis longus, then tibialis posterior. Out of all these muscles, there is a Soleus muscle is a special muscle in the posterior compartment because in the soleus muscle there is a venous plexus. There is a venous plexus. This venous plexus acts like a peripheral heart. Peripheral heart. This is also most commonly asked question. And next, the venous plexus in normal condition, if the person is active, that is well and good. But if the person gets bedridden, he is unable to move his leg, or paralyzed patients, what happens? There is a stagnation of blood in the this soleal plexus. Then it leads to DVT, deep vein thrombosis. Deep vein thrombosis. Sometimes they may ask as a clinical scenario questions. That is, the bedridden patient is complaining of severe pain in the back of the leg, and there is inflammation, fever. He also develops fever. Okay, like that they may ask. Okay, that is nothing but the DVT, deep vein thrombosis, and it is a peripheral heart. Concept of the peripheral heart. Sometimes they may ask as a short answer. Okay, that is another important thing. Next, tendons. That is the tendocalcaneus. Okay, ligamentum patella. These two things also you are supposed to study. These are the important ligaments in our body. That is why you also study. Next, coming to the popliteus muscle. Popliteus muscle, because it is the unlocking muscle of the knee joint. That is why this is also most commonly asked question. Popliteus muscle. Popliteus muscle is also you supposed to study. Okay. Next, sole of the foot. Sole of the foot, already I told you. There is a layers of the sole of the foot. There is they may ask as a fourth layer or second layer. Second layer, draw the neat label diagram of the second layer of the foot. Sometimes they may ask, sometimes they may ask fourth layer. Fourth layer also they most commonly asked. Okay, that is the second layer and fourth layer diagrams. All of you must practice, right? Next, arches of the foot, already we discussed. That is a medial longitudinal arch, lateral longitudinal arch, transverse arch, all these arches. And what are the bones which are taking part in the formation of the arches, and what are the ligaments, and what are the muscles which are supporting the arches, and what is the importance or functions of the arches of the foot. All these things you are supposed to study. And next, flat foot, club foot. Okay, these are all the hallus valgus, high arched foot. Okay, these are all the clinical conditions related to the foot. Sometimes they may ask as a short answers, or sometimes they may ask as a MCQs also. Okay, they may give a condition, then they ask which condition, like that, right? And next, knee joint. Knee joint, definitely it is a very important essay question, because this is the most prevalent condition in elderly people. There is knee joint pain. Nowadays, joint replacements are going on. Okay, that is why knee joint is the most important stock question, is a essay question. And next, intra-articular structures, that is cruciate ligaments, menisci. Okay, these are all the its attachments. All these things sometimes they may ask, right? And ligaments of the knee joint, especially cruciate ligaments, sometimes they may ask as a MCQs. The MCQs, or sometimes as a clinical scenario based questions they may ask. Okay, and cruciate ligaments and menisci. These are the two most important structures. Next, sometimes they may ask bursa around the knee joint. Sometimes bursa around the knee joint. And osteoarthritis, there is clinical scenario based questions they may ask related to the knee joint. And what is there? Ankle joint manaki inversion eversion movements. Inversion, what is inversion? What is eversion? And what are the muscles which are producing inversion and eversion movements? Okay, that is also most commonly asked question. Okay. Next, what is there? Venous drainage, already we discussed. Okay, in the venous drainage, we are supposed to study about the superficial veins, deep veins, and perforating veins. Okay, and varicose veins. This is the most common police constable story, like they may ask. Okay, that is a, and venous section. Venous section is the great saphenous vein. It is most commonly used vein for the venous section in emergency access of the veins. Okay, next, peripheral muscles, already we discussed peripheral heart. Okay, And lymph nodes, among lymph nodes, there is a superficial and deep group of inguinal lymph nodes, also most commonly asked question. And short saphenous vein, they may ask as a short answer, especially MCQs, which posterior part of the leg which is drained by which vein, like that they may ask. That is the short saphenous vein. Okay, related to the short saphenous vein. And sciatica, this is the most commonly asked question. Sciatica and tibial nerve, common peroneal nerve, and superficial and deep peroneal nerves. Okay, clinical aspects. Okay, that is the thing about the uh, lower limb, right, and upper limb. I think I covered all the points. Okay, anything missed, you please message me. I will give you answer. Okay, thank you for attending. Okay, thank you very much.